This is Dr. Daniels, Level 4, Bioterrorism. So what is bioterrorism? It is the intentional use of infectious biological agents or chemical substances or radiation. And any or all of these cause widespread harm and illness. So again, just like when we talked about trauma and triage, why is this important to us? Well, we need to recognize early signs and symptoms. Unfortunately, the effects of bioterrorism may not be seen right away, may not be seen within the first few hours. You may see them days to weeks to months to even years later. So the nurse plays an important role in understanding what signs and symptoms might be seen. We need to provide accurate information. Bioterrorism causes panic for everyone. When we had anthrax scare, when it was being passed in the mail, people were afraid to open their mail. When Ebola was just recently, a few years ago, there was big scare. People were afraid to travel. It's our jobs to know the facts, what's true and what's not true, so that we can provide the community with accurate information. And also, we need to be involved in emergency management plan so that when there are outbreaks, we can act. These are the agents we're going to be talking about. Table 6912, they're the most likely to be used. It's important not only to know the name, which I'm going to probably refer to just the disease or illness that it causes, but also to know the agent that causes it. So the first one we're going to talk about is anthrax. Anthrax, standard precautions, no special precautions for anthrax. Transmission. You can either inhale it, you can absorb it through your skin, so cutaneous, or you can ingest it, intestinal. It is not person to person. So if someone with anthrax, if someone has anthrax, they can't touch someone else and give it to them. Treatment, there is antibiotics for anthrax. So they typically start antibiotics early, and antibiotics often last for several months, sometimes as long as 2 months. There is also an antitoxin. And there is a vaccine, typically for the military or high risk. Their animals can become infected with anthrax. So those people who work with animals, livestock, vets, those who tan hides, they are at increased risk. So we do give vaccines for them and for the military. The vaccine does have to be for people over the age of 18 and less than the age of 65, and they can't be pregnant or nursing when they get the vaccine. Signs and symptoms, inhalation. So if they inhale it, the big sign and symptom you're going to get is shortness of breath. They develop fever, nausea, vomiting, shock, respiratory failure, and they can get hemorrhage or lung tissue destruction. If they touch anthrax, so it's cutaneous, it's on the skin, as you can see right here, they get this black depressed ulcer. And if they ingest it, so it goes into the stomach, they can get diarrhea or bloody vomiting. It's important to note that just because you get the disease, it doesn't make you immune from getting it again. Survival. it's only a 10 to 15% survival rate if there's no treatment. However, if they get treatment with the early antibiotics and for the extended period of time, there's a 55% survival rate. Smallpox. Smallpox precautions, they are droplet. It's highly transmittable. So when we talk about droplet, people think that they're going to inhale it, but what we're saying is that someone coughs or sneezes, and then someone else comes into contact with that mucus. So it's rarely inhaled from the air. Typically, it's direct contact with the fluids. Treatment is supportive care. There is no treatment, so no antibiotics for smallpox. And vaccine, there is a vaccine, but very few have received it. Just because we eradicated it. The last case of smallpox in the United States was back in 1949, and it used to be part of our immunizations, but because we eradicated it, we stopped giving it. There is a post-exposure vaccine. We typically try to give it within 3 to 5 days. If they get it in 4 to 7 days, it decreases the severity. There is no protection from the vaccine if the pustules have already started. So if they get all these little, what they call the smallpox, if the rash is already broken out, then there's no protection from the post-exposure vaccine. It has to be prior to that. So the major sign and symptoms obviously is the pox, these pustular vascular lesions. And what's interesting is that they're all in the same exact stage of development. So unlike other diseases where you'll see like chicken pox, you could have some that are healing and some that are just popping up. Smallpox, they're all in the same stage of development. They're mostly on the head and the extremities. And systemic symptoms include fever, headache, backache, vomiting. And they're contagious until all the scabs have fallen off. Now, basically, there's several stages of smallpox, and they incubate it for about a week or so, and then they start showing symptoms. So that's why if they've had exposure, positive exposure to smallpox, we do like to go ahead and give that post-exposure vaccine, because it could be a week or so before those pustules start showing up. They're most contagious during the rash stage. All right, botulism. Botulism precautions, they're standard, no special precautions. Transmission is, there's a neurotoxin producing bacteria. So this is normally what you see in like people who process their own canned foods at home, or infants with honey. This is why we tell infants they can't have honey. There's a bacteria that produces this neurotoxin, and we typically ingest it. So it's not person to person. So smallpox is person to person, anthrax and botulism is not. Treatment, there is an antitoxin, but there is no antibiotic. And we typically do supportive care like mechanical ventilation. There is no vaccine. So signs and symptoms, people a lot of times get this confused with Guillain-Barré, because Guillain-Barré is this rapid onset of muscle weakness. And that is typically because the immune system is being attacked. And this presents very similar. They ingest something either because they have those, like I said, canned home goods, or an infant that, ingests honey, and they develop, kind of sudden difficulty speaking, seeing, swallowing. They get drooping of the eyelids, like you see right here. weakness in the trunk and movement to the end. So it's this neurotoxin that kind of attacks the neuromuscular system. The paralysis can lead to respiratory failure, so that's often why treatment includes mechanical ventilation and supportive care. And like I said, it's often confused with Guillain-Barré. All right, plague. Plague is droplet precautions. So there is a bacteria. The rat often carries it. The flea bites the rat and gets it, and then the flea goes and bites a human, and they can spread it that way. We can inhale it. So, and it can be person to person. This typically happens in areas of overcrowding or poor sanitation. There is treatment with early antibiotics, but there is no vaccine. Signs and symptoms. Bubonic is the most common. This is where they get that bubo, which is that, sore that you see right there. They have extreme lymph node pain and swelling. And bubonic can then go into either pneumonic form, which is rapid death in 2 to 4 days because of respiratory failure and shock. You might present with some chest pain, bloody water sputum. Or it can go into septicemia. And this is the most deadly. I'm sorry. So if you don't treat the bubonic phase with the early antibiotics, they're going to get sick quick, and they go into either kind of respiratory failure or become septic and die. Tularemia. That's just fun to say. Tularemia precautions are standard. And again, this is one of those instances where it's not person to person. The tick, there's a tick on a rabbit. The rabbit carries the bacteria. That's why it's called rabbit fever sometimes. But the tick bites the rabbit and then gets it, and then the tick bites a person. But so it's not person to person. It comes from a tick or a rabbit. Also can be deer flies. You can get it from contact with infected animals or by ingesting contaminated water. Let's say wildlife has used something and you're out camping and you drink the water. You can inhale aerosols or dust or get it in the lab. There is treatment with early antibiotics, again, typically for a long period of time, like 21 days. But again, there's no vaccine. Signs and symptoms, they typically have flu-like symptoms: headache, fever, chills, cough. They can get red, swollen eyes. Swollen, painful lymph, or even develop pneumonia. So tularemia. Viral hemorrhagic fever, and there's different causes, like we talked about Ebola, but different causes that make this happen. Precautions: airborne. Transmission is typically viral, either from a rodent, mosquito, tick. It can be person to person. That's why there was such a big scare a few years ago. Treatment, there's supportive care. There's no antibiotic. There is an antiviral. And there's no vaccine. So basically with viral hemorrhagic fever, the person gets exposed to the virus and the vascular system is damaged. So the body's ability to regulate itself is impaired and the person has some hemorrhaging. Rarely is it life-threatening. So that's why we typically just do supportive care, because we can control it. Nausea and vomiting can happen, fever, headache, shock. If they lose a large amount of blood, definitely can develop shock. Obviously, if they don't have as much blood circulating, hemoglobin with oxygen, they can feel fatigued, exhausted. They might get some dizziness related to low volume, muscle aches, loss of strength. All right. And last but not least is acute radiation syndrome. So what is it? It's a mix of explosives and radioactive materials. They call them dirty bombs. The main damage or main danger is the actual exposure itself. Signs and symptoms depend on the onset and type. The onset and type of signs and symptoms, depend on the radiation exposure. So this is when we talk about nursing care and early recognition of signs and symptoms. This is where it becomes important, because something like acute radiation syndrome, there may be an explosion right away, but depending on the type of radiation, you may not see the effects for several weeks. So nurses need to be able to recognize, ask about past history or exposure, and put the pieces together. So they can have GI effects, decreased blood counts. There's 3 big phases. There's the prodromal phase, and this lasts the first few minutes to the first few days. There's nausea, vomiting, diarrhea. The second phase is the latent phase. This is where the patient looks and feels healthy, and this can last from a few hours to weeks. So they get exposed right away. They may feel a little sick. Maybe they think it's just from shock or from being scared. They get a little nauseous, and then they get better. They think, oh, okay, nothing's wrong with me. I'm doing good. And then illness sets in. And this is where they develop bone marrow suppression. On a CBC, we're going to look at decreased red blood cells, decreased white blood cells, decreased platelets. They may have some GI or CNS involvement. And the last stage is recovery, and it's either recovery and they get better, or death. And this can last anywhere from weeks to years. So without treatment, about 50% death rate. So it is high mortality if we don't catch the symptoms and start treatment. We treat with fluids, obviously, because these patients have a low white blood cell count, they have low platelets, low red blood cells. We want to be careful about preventing infection. Immediately after they're exposed, we want to remove their clothes, because the longer they sit in the exposed clothes, the more likelihood they are to get sicker. We want to wash the skin and debris, debride any wounds, again, to kind of decrease exposure as much as possible. And we might try something like potassium iodine, which helps kind of bind to the type of radiation and gets rid of it. So this is pretty dry information. There's not a lot of understanding. This is probably the one time in nursing we tell you to memorize. So what I would say is make yourself a chart like this and go ahead and put, agent, precautions, transmission, vaccine, treatment, signs and symptoms, and then put in there anthrax. And under anthrax, I would put, the agent that causes anthrax too. I didn't do it there, but, for anthrax, I would put maybe underneath, put bacillus, or for, under plague, go ahead and put Yersinia, and then put precautions, transmission, vaccine, and make yourself a little chart. So, for example, anthrax is standard precautions. Transmission is not person to person, it's from an infected animal. Is there a vaccine? Yes. Is there treatment? Yes. Antibiotics. And what are some of the big signs and symptoms like shortness of breath, the ulcer, diarrhea? And then keep going from there. And I didn't go on and make it for you. That's going to be on your own. But I would find this helpful for you so that you can kind of see it at a glance and know the difference between them. Because, again, our jobs as nurses is we need to recognize early signs and symptoms so that we can get treatment early, and we need to provide accurate information to the public so that it doesn't create widespread panic. All right, thanks guys. Have a great day.